All right, I'd like to call this meeting to order, the Polk County Board of Commissioners. Today is Tuesday, June 13th. Please join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, are there any comments for items not on this agenda? Hearing none, do I have a motion to approve the minutes of June 6th?
So moved.
I'll second that. All those in favor, please say aye.
Aye.
Aye. Motion carries. Next up, we have the Fall City Health Assessment Update with Brent Demoe and Abby Warren. Welcome.
Good morning.
Good morning.
You ready for us to just jump right in?
Yes, please.
So this presentation that we're going to show you guys has way more information than you probably want. So you're going to see me skip some slides because I just, we're going to try to condense this into what we think would be appropriate for you guys at this point. But just know you have this in your email, and there's also a full comprehensive 50-page report on our website that really dives into every data point. This is just kind of a high-level summary. So here we go. We wanted to find out the health needs and barriers for people that live in and around Fall City. There was a group that was meeting for several months that Commissioner Gordon was a part of, made up of the area's healthcare professionals. And I went to one of those meetings and quickly determined that there were a lot of people who wanted to find out what was happening in Fall City, but nobody ever asked the people of Fall City what was going on. So I volunteered our department to do a comprehensive needs assessment. We received a grant from Willamette Health Council. That grant helped us bring in Dave Guile, who's been a consultant in my department for the last decade. I wanted to just mention really quick, Dave and I could have done this project, just him and I, and it could have been done. But one of the reasons that I brought him in is we used it as a training opportunity for all program coordinators in my department when you see our committee. So now people like Abby and Annie and Stephanie and others know how to do an assessment like this in case we want to do it in other areas of the county as well. So our goals were to determine the family and community healthcare utilization needs and barriers, and to identify some possible avenues to meet those needs once we found them out. This just describes our timeline. We had a committee of people. We did a lot of front work, but the survey was really done around December. And then in January was when we really analyzed the data. And in February and March, we have started to share this information all the way up until now. There's some other things that have happened that we'll get to at the end, but let's get to what the data actually said. I want to mention our work group because Abby is here to talk about some of that here in a minute, but I also want to mention that we had really awesome interns from OHSU School of Nursing who helped us with this project. And the one up here named Anna, it was really awesome because she grew up in Fall City. And so the connection to Fall City, it was definitely having a local person is why we received the amazing response rate that we did, because she knew a lot of folks and there was a lot of trust there. So Abby's going to talk a little bit about how we got the results we got with all the different methodologies that we used.
Yeah, so part of my role and a couple of the other committee members' role was really to determine how do we get the word out. It's one thing to make the survey, make sure our wording is good, make sure the format works, but it's a whole nother thing to make sure we're getting the word out. And we knew how important that was. And so we wanted to meet people where they were at in all kinds of aspects. So we were like, how can we just bring the dosage as high as possible and make sure folks recognize the look of the survey, the feel of the survey, so that when they get access to it, they're ready to take it. And so you can kind of see the content right down there in the left corner. You'll see really that imagery and kind of the color scheme and the look of that was really consistent throughout all of our marketing materials. And so we kind of blasted it in a couple of different ways. We really leaned on local restaurants and local stores to share the message through table tents and flyers. We also had yard signs around the area that really did resemble the postcards that folks also got in the mail. We blasted out our own mailing through Vistaprint, which highly recommend. Vistaprint will send pre-posted mailers to folks. It was really convenient. It was great. And we were able to send a couple of different reminders. We sent an initial one and then a second one just to remind folks. And then we sent another one that we'll talk about in a little bit. We also worked with our schools to say, how can we get this out as quickly as possible to everybody that attends your school? So they sent it out digitally. We also had a presence at football games and some other events at school through Aaliyah Littleton, who was our school-based mental health associate at the school, which was incredible to have that connection there as well. So we really just worked collaboratively with lots of different spaces. We also went online and did a lot of digital marketing as well. So we worked with the Falls City Thrive Facebook page and group on that space to be able to send things out that way. And all of those really created a pretty effective marketing campaign. And we'll talk about the breakdown of where folks connected with us in our next slide. So you can see over 50% of people were connected to this survey, either through a mailing or through Facebook. So 52% combined. The mailer through the water bill or just that postcard connected with about a third of folks that took the survey. So 31%. And then another 21% was social media. And then the school connection was about 20%, community event down to 15, friends or family at 7, and then 9% connected in some other way, which is probably a combination of a table tent or a yard sign or something like that. So we really saw that that mailing was super effective, especially in conjunction with the social media presence as well. So it's really neat to learn what was sticking, what was working. And this is really helpful as we move forward in some other initiatives too.
We don't have a slide that describes this, but Abby, also talk about the incentives we offered, both local and not. And we were able to provide for anybody who took a survey, a $25 gift card of their choice. And I think the choices were important too.
Yeah, so we offered folks a choice of a gift card to a local restaurant, Boondocks, or the Breadboard. We also offered options for a Walmart gift card, Winco gift card, Safeway gift card, grocery outlet gift card, depending on what folks wanted. So we really left the choice up to the individuals to decide. And that was really neat too, to sort of see, and there's equal distribution. Some folks really were more interested in shopping local and some folks wanted that support for food and other things like that, which is great.
And now getting in really to the meat of the responses that we received, being able to incentivize, making sure that you're marketing the right way and to the right people, I think is why we had such an amazing response rate. So here is your response rate up here on this slide. You can see that we were, in the 50% area of folks that actually had a home in Falls City that we received a survey from. Once we got the initial batch of surveys and did so well, I worked with Eric in the GIS department and he created a mailing list for a 4-mile radius outside of Falls City. And we went ahead and emailed and mailed all of those folks the same survey. And we were able to get a bunch more responses because if something cool happens in Falls City where there's telehealth or mobile medicine or something, folks that live in those extreme rural areas may want to actually go there. So we have data for that as well. You can see that we got over 50% of the adults, and according to the census, we had 8 more children than the census said lived in Falls City, at least families represented who had kids. So we got a really good response, and that's broke down further in the next couple slides. This tells you a little bit about the percent of who took the survey. It was mostly women that took the survey, which is typical when it comes to something related to health. You can see that we had a broad age range of people that took the survey. The demographics of Falls City are mostly white, but we did get a few other races that were represented there, both Native American and Alaskan, and then some folks that clicked other. 43% of the people that took the survey had kids. And we also broke it down by insurance type. So private insurance, Medicare, Medicaid, and no insurance. And some of the data I'm going to share with you breaks it down by that insurance, but the full report breaks every question down by insurance type, which I think is the most telling information in this survey. So we also asked people if they were employed, where they worked, if they worked full-time, if they worked part-time. And we also asked questions about internet access because some of the potential solutions have to do with telehealth. And 89% of the people that took the survey did have access to the internet. We'll break that down for you a little bit later.
A quick question on
You
that
bet.
point. On the employment status, was that unemployed, was that question given to the respondent or was it a household question?
It was a household question. Some people actually answered it for themselves and then took it again and answered it for their spouse.
Yeah.
And then some people then answered it for all of their children.
Okay.
Most of the survey results were answered by one person,
Right,
and it was representing their household.
right on.
Now, there wasn't a way for them to necessarily click, I work part-time, my husband works full-time, or something like that. But we also have a lot of lesson learned from the way that we did the survey. And if we end up doing it again, we definitely have some tweaks. One of the things I thought I would share right now is that Willamette Health Council and Marion and Polk County, as they're working on the CHIP and the CHA plan, they're thinking of doing this survey in both rural and Marion and Polk County to get much better health data and health information, especially barriers. So I just sent them all of the survey information yesterday. They're going to have a look at it. Okay, so part of the first set of data, and this is everybody combined, all insurance types, on how often people visit the doctor and how often people visit the dentist. You can see that 84% of people go at least yearly to both to the doctor, and 63% go to the dentist. This slide isn't that exciting to me because I can see Commissioner Pope going, well, what about this, this, and this? That's too vague. Well, let's break that down a little bit then. So people, if you do it by insurance type, and to me, again, this is the most compelling. And when we're thinking about families that are at risk or lower income, this column right here for OHP and Medicaid, you're going to start to see a trend that they have the most barriers. They go to the doctor and the dentist least often, and they utilize urgent care and the emergency room more than any other population. So this is emergency room use by insurance type. This next one is urgent care. And again, this OHP Medicaid column here, they have the highest utilization. And you think to yourself, why is that? Are they lazy? Is that just the easiest thing? But when you start to really look at their barriers in the next few slides, you'll see how hard it is for them to find a doctor that takes OHP, how far away it is, how long it takes to get in. And sometimes things like urgent care and the emergency room are actually more convenient because they just can't get in. So here are barriers with everybody combined, all insurance types, from the top barrier to the least amount of barriers. But the number one barrier for all insurance types is it takes too long to get in to see my doctor. So I think you guys remember about 3 weeks ago, I had kidney stones. Today is the first day that I could actually get in to get the ultrasound. That's how long it took me. And I have great insurance and I'm not at risk or low income. And that's the barrier that I have, 3 weeks just to get in. So I totally relate to how people feel if they have the Oregon Health Plan, because there's fewer places that actually take the Oregon Health Plan. Healthcare costs too much was number 2. Healthcare provider is too far away. We hear that all of the time from everybody in Polk County, not just Fall City. I'm going to keep clicking through. If there's something you want to dive into, I know you're just going to stop and say, okay, Brent, let's stop there. This takes those same barriers and breaks it up with just OHP, and you're going to see them in red, and then all other insurance types in blue. And there's only 2 categories where OHP does not have a higher percentage of facing these barriers than anybody else. But some of those are pretty significant differences in how long it takes to see a doctor or what some of those barriers are. This really breaks it down by all insurance types, from no insurance to Medicaid, Medicare, and private insurance. And in almost every category, people that have OHP, Medicaid face more barriers. So we know that having a full-time clinic in Fall City is just not going to work. There was a clinic there for decades. It closed down about 12 years ago because there's just not enough patients there. There's not enough visits. So we know that if there's solutions to help Fall City, it's going to have to involve either mobile medicine or virtual medicine or a combination. So we asked questions about, have you already done any kind of virtual visits, or would you do virtual visits? And these next few slides are also compelling on how many people would use it and how many people have used it. So the purple is they already have used virtual care, and the red said they would use it if it was available. So for a regular doctor, 49% of everyone who responded to this survey, they've already accessed virtual care for their regular doctor of some kind, and 63% said they would if it was available. So dental care, that's a little bit harder to do, maybe for some kind of checkup, but you can't really get dental care virtually. Mental health care, you can see 25% of people have done it, but 47% would do it if it was available. And the medical specialists, that had to do with things like anyone who's not your regular doctor, an orthopedic or something like that. You could see that people would really be interested in that if it was available. So it breaks it down further by insurance type of if people would be interested in a virtual visit based on the insurance that they have. That one's not super exciting. I'm going to skip it. And then we also asked about mobile healthcare. And in the actual survey, it described what is mobile healthcare. You know, this is like a vehicle or a clinic or a doctor that comes, you know, on Tuesdays once a week, and they accept your insurance. You can see that plenty of folks would be interested in that if it was available for all types of care.
Was there any narrative on any of these answers? So for example, excuse me, on the mobile health care insurance type, see a regular doctor, the Medicare number pretty low. There's likely a reason for that. And was there any explanation allowed or an opportunity to understand why those Medicare patients see it that way?
How do I go backward?
Previous.
I wish I can see that.
One down, you're there.
We're so close.
Here?
Yeah.
Is this the one you're talking about?
Yep,
And
47%
tell me again, Commissioner, which one we're looking at?
Medicare,
Regular doctor, Medicare 47.
first box.
Yep. Would you access mobile health care? 47% said that they would. And your question again is,
Why would that number be so much lower than the rest? Was there an opportunity for them to explain their answer in the survey?
yes, it's not captured here, but I definitely have everybody's written answer as well. You want me to see if there was anything
Yeah,
significant?
so what I'm
there?
interested in here, and by the way, I think you'd find that if you did this survey across the entire county, the numbers would likely be the same.
Mm.
'Cause I would likely answer a lot of these the same way.
Yeah.
I don't need to be in Falls City to feel this way in a survey. But I'm curious about, again, because we anecdotally say a lot of things about Medicare and Medicare patients, but here's a spot right here that says, yeah, we're fine in some cases, I think. And I'm curious about that, if there was an opportunity for them to explain that answer, what it is. And maybe it's because they're getting their primary care needs met in some cases. Or maybe it's that they've just given up, I don't know. And so it's interesting to me that category is as low as it is. And honestly, the no insurance side is also an interesting number. I mean, the question is, would you access it? And
Right.
I mean, and the prior slide is also the same. Would you access care virtually by insurance? And would you access then mobile care is the same,
For no insurance people?
no insurance, so
They were 9% of the respondents. Medicare was 20%. So one of the things.
it's
excuse me,
68% of that 9%, yeah.
One of the things we can do is I can sort these answers only by Medicare patients, that 20%, and you can just see only their data across the board and their comments if you want. So I'll work on some more things related to Medicare and see what it shows up.
I guess my concern here is, again, that we don't leave the impression to anybody that, oh my gosh, we got 68% of the respondents with no insurance and are lost. They're not. It's 68% of a 9% group.
That's right.
And there's some anomalies in there likely. And if I'm a healthcare administrator, for facilities here and in Salem, et cetera, I'd want to break that down to, well, how many numbers are we really talking about here? What are their real stories? So
Some of the folks that indicated no insurance were also the ones that indicated that they don't trust doctors.
Mhm.
And so there could be reasons for that.
For sure.
Like lawyers.
Imagine you'd find some variance by age too. Medicare patients are generally older and less trusting and less likely to use use technology. But there have been a lot of great efforts in Falls City to kind of bridge that digital divide with those populations. So it's also an opportunity.
Learned that.
And I also believe it's not unique,
So,
like I just said.
Brent, run it without percentages, run it with real numbers. That way you can see what, because percentages are irrelevant when you get small numbers.
Yep, that's gonna show like 4
Yeah.
people
Right, right.
when you get to
right.
that kind of percent.
And you can also show what the total in that group was, and you'll be able to see.
Right.
You know, what the real picture is a little more when you have small
Yeah,
groups. When you have big groups, then.
It'd be more meaningful to me if it was numbers that 4 out of 400 or whatever the total respondents were, or the respondents on this particular question.
Yep.
You know, I think that's important to note.
This next slide breaks down people who took the survey who had kids. You could see that they had a much higher response rate to wanting to use virtual or mobile care than those who didn't. So those numbers were also pretty significant and starting to make a case for if there were mobile or virtual options, people who had kids would definitely be willing to either do that or try that, or that they're actually doing it at a higher percentage than people who don't have kids. This slide looks pretty busy, but I'll just do the main parts. It's really that yes question at the top. So all respondents compared to people who have kids, and this breaks it down by doctor, by mental health, getting immunizations or well child visits. People who have kids are more willing to do those things virtually and through a mobile way than people without kids. We could not do a survey in Falls City without asking some regular FCO kinds of questions too. So we also asked people any other resource needs that there might be in Falls City. And these are listed in order of the most asked for. Activities for kids, 70%, 77% of all respondents wanted more activities for kids. Transportation, public access to computers, help with basic needs, rent, utilities, and other. None of those are surprises to us in any rural area, but some of the things that we're talking about with the healthcare partners are, what if you had some kind of traditional health worker outstationed in Falls City who was part of the community to help connect people to all of the available resources that were there? Is there a way to fund something like that? Is there a way to bill for something like that? So those are all the ideas on the table. So some of the key findings, 40% of Falls City households returned a survey representing 782 people. Almost 90% have internet access of some kind.
That's 90% of the 40%. It's not 90% of Falls City.
90%
Yeah.
of 782.
Right.
Well, but 40% of households, so
Right.
only 36% of the households. If you don't know what that other 60% have, so
That's correct.
Again,
Fair.
percents distort what you're.
You can make inferences, given the high response rate, like a good response rate in the population is 10%, 40% is off the charts.
So I would say when you have even though you had a high response rate, because you're working with such a small group of numbers, percentages are irrelevant to me. It's the real numbers.
Yeah.
That matter.
For sure.
I'm going to look on here if there's anyone that I want to highlight. We've talked about most of these already. So getting to some of the end stuff. The recommendations that we gave to the funder, Willamette Health Council, a couple months ago was to have a regular committee that meets in Falls City. So they've put that together. I'm on that committee. I haven't been able to go. They had one meeting. I think I was on vacation, but I know Commissioner Gordon goes to that. There's representatives from Public Health, Behavioral Health, Pacific Source, Salem Health, Willamette Health Council, and some other medical and insurance folks. And their goal is to not let this information and data just sit there, but to look for solutions, because everybody is motivated to try to have better healthcare access in Fall City. Number one, it's a cost savings. When people utilize the emergency department and urgent care, it costs insurance a lot more than if you actually went to your doctor and had regular visits. So that committee has already been formed. We talked about having a health fair in Fall City, and Abby's going to talk about that because that happened a couple of weeks ago. That committee that I spoke about is really working on establishing a physical healthcare location in Fall City, whether that's mobile or virtual or both. So that's the goal of what that committee is doing. And Abby, you want to talk about the Happy Dance and Health Fair?
Yeah, so like Brenton said, one of those recommendations being more presence in Fall City, especially as it relates to resource connection. And so the Fall City Thrives group had the second annual Happy Dance last year, was the first one to honor Mental Health Awareness Month in May. And it was really geared towards just having a fun community event where folks can come together and do something fun and have just a nice sense of community. And it was really well received last year. And so they were planning to do it again. And we said, hey, why don't we tack on some resource connection there and just some opportunity to really enhance what's already happening and what the community was already excited about. So in partnership with those amazing OHSU School of Nursing interns and our team and Brent and Dave and a whole collaborative, we helped kind of put together a little bit of a resource fair. So we had about 17 resource booths there from all different kinds of resources that are accessible to folks that live in Fall City. We also had free food, music, and it was a really fun event. We had about 200 Fall City residents attend that event, which was great. We had fun giveaways, and it was just it was a great time for the community to connect. And we've heard lots of really good feedback from the Thrives group, but then also from community members and just anecdotally from providers that were there that day. So there's a lot of good connection that was made there. And we really hope that this feels like a first step in response to some of the things we've heard and just an effort to really make those connections and be really intentional to be connected in the area.
Also important to point out that was also completely funded by Willamette
Yes.
Health Council.
Yeah.
All of the prizes, the health related, people got water bottles, people got all kinds of things. Everything was a health focused theme, and the Health Council paid for all of that.
The food was incredible too. Just so you know.
What was the food?
Tacos,
Yep.
so Mexican, like authentic Mexican, Greek food, and then like build your own snow cone
Were
thing.
those two different things that you just said?
Two separate cards.
You said authentic Mexican
Yeah.
Greek food?
And then
Authentic Mexican and then a separate cart.
Gotcha.
Yeah.
we could put it together.
You were there too? Was it good?
Yeah, it was great. It was awesome. Grease lightning.
So that's the high level sort of summary of the data collected and some of the next steps. Questions?
Well done. As I've said in the steering committee meetings and kind of, so these conversations started before it was when I was mayor of Fall City. And I think what Willamette Health Council and other partners are really looking at this as a pilot to replicate this in other underserved communities, whether it's, underserved due to geographic reasons or income or, race, whatever it is, they want to use this as a methodology to pinpoint healthcare access for certain populations. So this data is super rich. As we've been told, Willamette Health Council wants to use this methodology again. I think it's really rare to get this kind of response rate, and especially in a community like this with trust issues. And I'm looking forward to seeing what we can do. It's looking like a community health worker / static location with a mobile docking kind of model. But I was really encouraged by how many people are open to the telehealth.
Yes.
I was really surprised by that actually.
Yeah.
And I think given that there's a good percentage of folks that can create a norm in a small community like that if we implement something. So I'm pretty excited to see that. The community has been asking for health services for a long time since the clinic closed. So thanks for all your work. Yeah.
Okay, thank y'all.
Oh, I do have a question now. So I didn't see veterans counted in any of the survey. So what's the veteran perspective for healthcare in this survey?
Don't remember if veteran was a demographic. I don't remember, but if it wasn't, it should be. But I'll definitely check and see if there was, if they were a veteran, if they clicked that.
I mean, I wish there was a way, but of course we have national policy that dictates this. But I mean, and you should know this. I mean, just basically from your experience, you know, how many vets do we have up there that have to go all the way to Portland for their primary care? Not fixing that.
You guys know how bad the data is. There's nobody that they can estimate how many veterans live in Polk County. And it's just under 7,000, but there's no registry of any kind that anybody is maintaining on where veterans live.
Right. And so I wonder in this, you know, going back through some of these responses, if there was a way to qualify some of the non-insured answers, if that wouldn't be some of those people, because they're essentially non-insured. I mean, they're, you know, healthcare needs need to be met by the federal government for the most part. So I'm interested in that. The other thing is, again, I appreciate that the focus is on Falls City, but there are so many answers in this that I think any of us would answer the same. And again, any of us, you just told your own story about having to wait for a primary care visit. And there, I think more often than not, all of us are being told, just go to the emergency room. Don't wait. So any emergency room answer, and I have these conversations with people that work in administrative roles in the hospital system that say, this is what we are dealt with. It isn't specific to any particular demographic. It is just the healthcare system and the way that it's not right, but it is what it is. And so I want to make certain that as we're having conversations with people responsible for establishing healthcare facilities, whether they're mobile or they're brick and mortar, that we have the backdrop of the system against that the survey is up against, because we may find that there are a lot of answers in the survey that match everywhere in Polk County. And again, I get there are no insured, you know, there's some no insured, and again, folks in the Medicare and Medicaid coverage, I mean, we should have pretty good coverage for them. Again, outside their city that they live in, I get that, but all of us are having to travel longer and longer distances for our primary care needs. Doesn't matter what our insurance or method of payment. That's just the way it is. So I want to make certain that we're not trying to create a narrative here that says they're in crisis. I don't think they're in any more crisis as far as access to healthcare than I am. Again, I don't live in a city, so I have to seek healthcare. I have to travel. It's a challenge for all of us. And for older people, I mean, I have parents that live in this county that have a difficult time. They're in their 80s. It's hard for everybody.
We did ask people where their healthcare is, and it's Albany, Corvallis, and
All over the
Salem.
map,
That's
right.
how far people have to go just for their regular doctor and regular dentist. There were also at the health fair, we were able to ask. We had a booth where we asked other questions, and we're still analyzing that data. But a lot of folks don't know that they have the ability to change if they have OHP or any Medicaid or Medicare, that they, you know, you're assigned to somebody, and that somebody may be the furthest one from you. You could actually request that to be changed, but folks don't know that they could do that. There are people that think once they're assigned, they have to stick with that clinic or where they were assigned to. So there's been a lot of talk with our insurance partners that partner at the Resource Center of getting information out that people could actually request to have their primary care be in Dallas instead of Kaiser, or instead of North Salem or South Salem or Corvallis.
And I guess the other thing is I appreciate all the work, all of it, absolutely. But again, I always want to make certain that I'm comparing apples to apples. And so with your years of experience, how many of these have been done across our county that you're aware of, these kinds of surveys?
I think there's been surveys done, just not as comprehensive and not with as high of a response rate. I've never seen a survey that asked all of these questions in one shot that got nearly 50% of the surrounding area and, you know, that town. But there are people who ask some questions, but not this detailed.
Well, I'm encouraged by them wanting to use it for the Cha and Chip, so we could get a more detailed analysis of the state of health in Polk County, Marion and Polk County. So hopefully they're able to replicate this, but it's very labor intensive. I mean, I witnessed it. Big.
Well, there still has to be an investment by somebody. It takes real money.
Yeah,
And I've been doing this a while too. And so, again, I want to make certain, in all fairness to all of Polk County constituents, that we're not separating a community in our advocacy without the full backdrop of the entire community that we serve, and make certain that we compare these answers the best we can to answers we might get from any community.
if there was funding available from one of the other funders, this methodology, and now that we have all of the work already done, it would not be too difficult to do this in every community in Polk County, as long as there was, the major part is the funding for the incentives to make sure that you get people to actually spend the time to take, 8 to 12 minutes to fill out a survey. Because people don't want to do that if there's not something shiny at the end. They're just not going to do it.
Well, and I'm not suggesting or advocating you do the work either. I think the work, to the best of anyone's ability, has been done. Again, we have a health council that is the representative for the Oregon Health Plan in this state, and they should have data. We have hospital systems in this region that should have this data for a broader cross-section that we could use. So I'm just suggesting to all of the partners coming together, put this data in front of a backdrop of a bigger picture to try to isolate, because that's what they're going to do. I mean, eventually, if I'm in the administrative board of a hospital system, I'm going to want to see that, because I don't know how I'm going to make more investments as a medical system in a specific community without understanding that backdrop.
Agreed.
That's my thinking. So I would hope that we can get Justin and his team and others to say, yep, we should be able to put those layers together.
That's the intention, is that this is kind of a pilot. Part of the difficulty to get deep data is the access to the community sometimes. And given the local connections, we're able to do that. So I think their intent is that this is a pilot, that this is not a one and done project. So hopefully that's the case.
All of those folks have utilization data. They have that at the push of a button, but they've never asked the whys, or why is the utilization such? So
Thanks.
okay, thank y'all.
Thank you. All right, next up, we have declaration of surplus property, Mr. Whitaker. Welcome.
Good morning. So you have before your recommendation for a bunch of surplus equipment to be sold. And so we're just here to answer any questions you might have before you make that declaration. What's that?
Don't you even have the timbers?
No, because I haven't had it yet. Yep.
Your question is if I have questions about a list I haven't read yet.
Oh, was that not provided to you? Okay.
Friday?
So I can go over each of the items. We've got a BH3 is a 1982 backhoe that's just reached its end of serviceable life. We've got a pressure washer that is a diesel powered pressure washer. When we built the new wash facility out at Public Works, we didn't want to go through all the work that was going to take to have another diesel tank out there and all the new requirements with that. So we switched to natural gas. So that made this one unnecessary. Our water truck T881 is in 1975. It's reached the end of its serviceable life. We've been having more maintenance problems with that, so that's going. Cat lift truck, forklift, which was, I think for years, didn't the Mo have that?
What is it?
A forklift?
No.
Some other department had a forklift and they,
If I had it, I'd still.
yeah.
That's exactly what I was.
We've got
Opportunity.
a Cat Olympian. Got a Cat Olympium generator. This was our public works generator for years. That has been replaced. We've got the Kohler generator, which is the old courthouse generator that got replaced a couple of years ago. And then the rest of these are, well, we've got a bunch of vehicles that are a combination of sheriff vehicles and public works vehicles, and then a refrigerant recycling center, which is something for the shops for doing AC work. And then finally, our case roller, which is no longer serviceable and doesn't operate. And then we also have some bridge timbers that we've advertised. We're just selling those one by one, but those didn't make it on this list, but those are there for surplus as well, since we're aggregating everything together. So our ordinance requires that when something is over $3,000, we have the board declare it surplus, and some of these might be less than that, some of them over it. We just said, let's just get it all at once.
Then once it's approved, it'll go to the state surplus site and game to.
That's the how.
Yeah, so I'll probably put out a list on our website with the timeline, because I won't list all of them all at once. But just over the summer, sell them all. Usually the auctions go for 2 weeks. So I'll just kind of stagger them.
It's an online bid.
It's an online bid. Yeah, they have to go to this government surplus website, create an account there. It's all done through there. Is
And
that
that-
the timbers?
And then, yeah, the timbers are located on our website, Public Works website.
Move to so declare.
I'll second that. Any further discussion? All those in favor say aye.
Aye.
Aye. Thank you both. so
Right.
much.
Yeah.
You,
Any non-listed items we need to take care of before we adjourn? With that, we'll adjourn. Thank you. That's the first question I asked you during the